Hey. In this video, Dr. Beck Ellis talks depression, CBT, and suicide prevention.
Hi, I'm Beck. I'm a therapist. My job is to diagnose and treat your mental health. This is my office. All day, I counsel people just like you, who are struggling with their mental well-being.
We do all the hard work, and he gets the credit every time.
I'm so sorry. I, like many therapists, specialize in CBT, cognitive behavioral therapy. CBT is one of the commonest forms of counseling. Millions of people around the world are on waiting lists for these sessions because it helps treat a wide range of different mental health conditions. Let's look at, for example, depression. Depression is low mood that lasts weeks or months and affects your daily life. It can develop after an activating experience, either a traumatic event or a prolonged exposure to extreme stress.
You're useless. You're a loser. You're just a burden. No one will ever love you.
Or it can develop without any one clear cause. Your brain creates an irrational, incorrect pattern of thinking about yourself, the world, and your future. You perceive and interpret day-to-day life through a negative lens. The glass is always half empty. Your mind is consumed by a constant stream of negative thoughts, which weighs down your whole brain like a heavy, black cloud. These constant negative thoughts about every situation create negative feelings. The negative thoughts and feelings then influence behavior.
Bro, you gotta come down and join in.
No thanks.
It affects every aspect of your life. The root problem is the automatic negative thoughts, because it is them that create the negative feelings, which influence the negative behaviors. Negative behaviors and feelings then create even more negative thoughts. And this vicious circle creates and maintains what we call clinical depression. So, CBT sees the root problem as the automatic negative thoughts. So in order to improve your feelings and behaviors, we have to start by changing the thoughts. First, we identify and capture the negative thoughts. During talking therapy, or by journaling day-to-day events, and the thoughts you had around them. Reading back your journal allows you to objectively analyze your own thoughts as an outsider looking in. Then, we question the negative thoughts. What makes you think you're not good enough?
Well?
For what reason would your boss fire you? Now, we can argue and challenge your negative thinking patterns.
Those girls do not feel sorry for you. They like you. They told me.
We compare evidence for and against the negative thoughts.
Sometimes you push me away, but I keep coming back. So you're not on your own. I really do care.
Boss? How am I doing? Am I doing okay?
Dwayne, yes. You are doing just fine.
Over a period of months, or even years, we help you realize that your thoughts are often not accurate. And hopefully we teach you to dismiss the negative thoughts before they take root in your mind and affect your feelings and behavior.
No!
Insight that your temporary thoughts and feelings are not always concrete facts is needed for any mental health recovery. The CBT therapist's aim is to replace irrational negative thoughts with a more realistic, balanced perspective on life. To increase your chances of success, we doctors and therapists strongly recommend you proactively do things that boost your mood and lift the heavy black cloud. This cloud blocks any positive thoughts from entering, and the depressed brain simply cannot lift this black cloud by itself. So, what things do you do that boost your mood and lift your cloud? Dwayne, what did you find helped?
Sport clears my head.
1. Sport, or any other moderate to intense exercise. Exercise releases endorphins, which lift the cloud, clear your head, and boost your mood.
Talking to people kinda reminds me I'm not alone.
2. Connect to people. I know you lack motivation, but force yourself to connect. You'll realize that some of your negative assumptions about others are false, and it will show you that you're not alone.
Dwayne, bye.
Get home safe, okay? And truthfully, I was skeptical about antidepressants. But after my doctor found me the right drug, and we eventually got up to the right dose, it has changed my life.
3. Give medications a chance.
You hear about all the bad things, side effects, becoming reliant on them, withdrawal symptoms. But you never hear from the vast majority that have good reviews, like myself. Simply put, I was in a bad way, I needed help, and antidepressants, together with CBT, gave me my life back.
There are other lifestyle factors which may also help. Make it a priority to get enough sleep.
Yes. Cut down caffeine. Go to bed earlier. Seek help if your racing thoughts prevent you from getting to sleep or staying asleep. Because lack of sleep definitely worsened my mood.
Minimize alcohol.
Alcohol in moderate to large quantities started to act as a depressant. It could take me to a really dark place.
That's because it slows the connections between your brain and your body. It is well known that this psychoactive substance can radically change the way you think and feel, so be careful. Minimize alcohol. Everyone goes through some stress, but if your stress levels are impacting your daily functioning, straining your relationships, affecting your mood, it's worth taking active steps to reduce your exposure to it. Establish firmer boundaries. Delegate. Practice a weekly sport or hobby. Work part-time. Consider a health sabbatical. Prioritize your annual leave and vacations.
Excuse me, doctor. From the perspective of a friend or relative, if we know of someone who's acting different, withdrawn, less sociable, isolating themselves, what can we do to help?
Just be kind. In whatever way you're comfortable with. You can reassure them that you're there if they need anything. You can give them a passing compliment.
Great PowerPoint yesterday.
Really?
To boost their
Thank you.
morale. Anything that just reminds them that they matter.
Hey, long time. I'll call you for a catch-up.
Okay.
And, if you get a chance, please, break down the stigma.
You know my mom and my brother both have anxiety, so you're not alone, bruh.
Everyone is struggling with something.
This does not mean you're weak.
I've been on antidepressants as well.
Come play football with us this weekend.
If there's anything you need, please call me.
There is a support group I recommend. It really helped me.
I'm here for you.
Take my number.
My daughter has depression. I understand.
Prozac worked for me. You should try it.
In our world today, we are facing a mental health crisis. Data now suggests that someone commits suicide approximately every 40 seconds. That is 16 people since you started watching this video. And just think, in your day-to-day interactions, you have the power to give somebody hope.